Welcome to Why I Vaccinate, presented by the Franny Strong Foundation and the Michigan Department of Health and Human Services. I'm Ann Thomas, and I am here with my co-host, Veronica McNally. And our first guest on the show today is Dr. Lee Benjamin. He's a pediatrician and an emergency room physician with St. Joseph Mercy Health System in Ann Arbor. Dr. Benjamin, welcome to the show.
Thank you so much.
Doctor, start out for our listeners and just talk a little bit about the state of Michigan's emergency rooms during the height of the COVID-19 pandemic.
Sure. Well, during the height of the pandemic, a lot of this was new, and we've done tremendous learning since then. And our emergency departments across the country were preparing. And fortunately, we were in a situation where we were very, very well supported. We were able to provide the care to our patients very safely and effectively, keeping everyone safe. The emergency departments at that time were primarily full of COVID, to be quite honest. Other people tended to stay away, which has led to some poor outcomes. And one of the clear messages is that we have now learned how we can take care of our COVID patients and our routine patients who require emergency services to make sure everyone gets the care they need in a timely manner.
How would you describe the situation now, emergency rooms this summer, right now?
Right now, well, it's interesting timing because as we've seen across the country, we've seen peaks with the new Delta variant in COVID, and it's affecting a lot of people. As a matter of fact, Florida is worse than their previous peak, and we know that they had it bad down there last fall. In Michigan, fortunately, because all of us made sacrifices early on, we really did a wonderful job controlling the spread. We're one of the lowest states as far as case counts per our population. But even despite that, we're now starting to see our cases cropping up, and we know the Delta variant is in our communities. We are seeing more frequent presentations to the emergency department, and in large part, this seems to have become a pandemic of the unvaccinated. What we're seeing across the country and locally is that those patients who are sick enough to get hospitalized or enter intensive care units are those who did not receive immunizations, and that's the pattern across the country. Those areas where the vaccination rates have been low for whatever reason, they're seeing the big outbreaks. Those who had more vaccinations early on are seeing less of the outbreak, but it is spreading, and we need to do all we can to protect ourselves and to protect our providers, our loved ones, our communities, so we can really get control of this.
As a pediatrician, what are you seeing with regard to children?
Yeah, it's scary to be a parent right now. There's so much information. It's really tough to know, well, what information should I trust? What should I not trust? What I would recommend is talk to your doctors. They're the ones who know the science, who know the medicine. And there's one fact that I think really people need to appreciate. 96% of doctors across the country are vaccinated. We know the science, we understand the risks, we understand the rewards, we understand it's the best way forward. So what we can do for our kids, first of all, if they are old enough to get the vaccine, get vaccinated. If you're not comfortable yet, if you need more information, talk to your doctors. But patients 12 and up can get and should get vaccinated. As far as those younger kids, that's the question. What do we do about those preschool kids? Fall's right around the corner, return to school questions are coming. The best thing we can do to help them is for adults and older kids to get the vaccine. Let's control the spread of the disease in the community, and then our kids won't be exposed to it as much. So that's one of the main messages, what we can do to help our kids, because they're smart. They hear us speaking at the dinner table. They see what's around them. They're scared too. We need to do everything we can for them. We certainly are seeing that COVID is affecting kids. And that's one of the myths out there, that kids don't get COVID. Well, 20% of the latest outbreak are kids 18 or less. We know that. The sheer numbers are amazing. The American Academy of Pediatrics reported a couple of weeks ago, 72,000 patients across the country, kids, develop COVID. And if you do have a poor outcome, even though you're young and healthy, just by the sheer numbers, there are going to be pediatric cases that end up in ICUs. And we're seeing that. They're coming to our hospitals. They're coming to our intensive care units. This is a dangerous disease for everyone, children included.
And Doctor, I know my co-host Veronica McNally has some follow-up questions for you. Veronica.
Doctor, when those kids present to the emergency room, how are they presenting?
Well, fortunately, most of them are presenting with signs of upper respiratory infections. The cough, the runny nose, the fever, some with a lot of body aches, headaches are common. There are a couple of things with the kids that are very specific and very worrisome. Uh, of course, with all COVID, one of the worst things is if it does affect the lungs to the point you can't get oxygen. And these kids come in breathing very heavy. They require a lot of oxygen. They may require extra support and need those intensive care units. We're also seeing, and Detroit was a hub of this early on in the disease, a post-infectious inflammatory syndrome that was leading to dangerous heart issues. These patients were commonly in the intensive care units. So we're still on the lookout for that. These are patients who do well with their initial COVID infection, as we hope most kids will. And then later on, their body just develops this immunologic response where there's just massive inflammation throughout the body that can be very dangerous.
So we know that immunization rates have fallen a bit because parents have not been getting their kids to the pediatrician offices for a variety of reasons during this pandemic. What are you seeing in terms of numbers in pediatric patients in your hospitals?
Well, there's two things that I think are important to recognize here. We have our COVID vaccinations, right, which we're now seeing tremendous increases in those adults and older kids getting immunized where there are giant outbreaks. So the southern states where they're having the big outbreaks, we've suddenly seen a return to immunization. So people are learning that this is a dangerous disease. That is the only way to prevent ourselves. So those kids 12 and up are getting immunized for COVID specifically. But on the flip side, because of the pandemic, patients aren't going to their pediatricians, their trusted medical advisors, their medical home, who really can help guide throughout the pandemic and with general health questions. And what we've seen is there's been a real drop in the rates of routine vaccinations. And that would be the things that we bring our children into for their 2, 4, 6-month vaccines. And then as they get older to prevent diseases. And we haven't really seen large outbreaks yet, but we're very fearful that some of these diseases we just don't see are going to come back. For example, measles. Measles was a classic disease that affected loads of children, led to pediatric deaths throughout the year. We know that populations that don't get vaccinated for measles tend to have outbreaks. We've seen them over the years, and this can be very, very dangerous. So the message is clear. Yes, we need to take care of our children from a COVID standpoint, do everything to protect them, and get in to see your trusted pediatricians and medical advisors for routine health maintenance also. And when you do need emergency services, please don't delay them because of fear of catching COVID in the hospital. We have our processes very well thought out. We're able to keep patients safe. Early in the pandemic, we were seeing kids with sinus infections that were going to their brains because they couldn't come in, they wouldn't come in and get the care they needed sooner, and the infections ran rampant. This is across the country. We saw appendicitis cases that came in very late, where if they had come in early, the kids would have done much better. So don't delay care to your primary providers. Stay healthy. And when you do need emergency services, we are there.
Dr. Lee Benjamin, pediatrician and emergency room physician, St. Joseph Mercy Health System in Ann Arbor. We really appreciate the advice today. Thank you. It was great to meet you, great to talk with you.
Thank you, gang.
You are listening to Why I Vaccinate. Coming up next, we're going to have some important advice for parents as they get ready to send their kids to school.